I thank the gentleman for yielding. Mr. Speaker, we would not be having this debate here today without the compassionate leadership of the late Senator Paul Wellstone. I ask unanimous consent that a statement from Senator Wellstone's son, David Wellstone, be entered into the record at the conclusion of my remarks.
So ordered.
I also want to thank the Speaker and Majority Leader, as well as Chairman Rangel, Stark, George Miller, Dingell, Pallone, and Andrews for their key support. Mr. Speaker, the issue before us today is not just another public policy issue. The issue before us today is a matter of life or death for 54 million Americans suffering the ravages of mental illness and 26 million Americans suffering from chemical addiction. Last year alone, more than 30,000 Americans committed suicide from untreated depression. 150,000 Americans died as a direct result of chemical addiction. On top of the tragic loss of lives, untreated addiction and mental illness cost our economy $550 billion last year, according to the Wall Street Journal. In fact, the Journal cited $70 billion was lost from our economy because of untreated depression alone. Mr. Speaker, I'm alive and sober today only because of the access that I had to treatment following my last alcoholic blackout on July 31st, 1981. I woke up that day in a jail cell in Sioux Falls, South Dakota, and I'm living proof that treatment works and recovery is possible. But far too many people in our country don't have the same access to treatment that I and other members of Congress, other federal employees have. A major barrier for thousands of Americans is insurance discrimination, plain and simple, against people in health plans who need treatment for mental illness or chemical addiction. The legislation my friend from Rhode Island, Mr. Kennedy, and I have authored, H.R. 6983, before us today, would end this discrimination by prohibiting health insurers from placing discriminatory restrictions on treatment for people with mental illness or addiction. No more inflated deductibles or co-payments that don't exist for physical diseases. No more limited treatment stays that don't apply to physical ailments. No more discrimination against people with mental illness or chemical addiction. And I just want to say a word about the chief sponsor of this legislation, Mr. Kennedy, who has worked tirelessly on this bill and who has we've worked together for many years now on this legislation since he first came to the House. And I want to publicly acknowledge and thank Mr. Kennedy, who has not only worked hard on this legislation, but has been an inspiration to literally hundreds of thousands of Americans as we traveled this country to 14 states holding field hearings on this important legislation. Mr. Speaker, simply stated, the Paul Wellstone and Pete Domenici Mental Parity and Addiction Equity Act, which has, by the way, 274 co-sponsors from both sides of the aisle, simply stated, this provides equal treatment for diseases of the brain with the body. Diseases of the brain should be treated the same as diseases of the body. There is no government mandate. Nobody's mandated to insure anybody for treatment for mental illness or chemical addiction. There is no mandate in this bill. All it says is if your policy includes coverage for mental illness or addiction, then you cannot be discriminated against. That is, those ailments must be treated the same as physical ailments. Providing treatment equity, Mr. Speaker, is not only the right thing to do, it's the cost-effective thing to do. And believe me, we have, over the last 12 years, assembled all the empirical data in the world, all the actuarial studies in the world, and they all show the same thing, that equity for mental health and addiction treatment will save, not cost, but save literally billions of dollars nationally. At the same time, Mr. Speaker, treatment parity will not raise premiums more than 0.2%. That's according to the Congressional Budget Office. What better source? Let me repeat that. Premiums will not increase more than 0.2%. So in other words, for the price of a cheap cup of coffee per month, and I'm not talking about a fancy restaurant, I'm talking about Pete's Diner, where many of us go, millions of people could receive treatment for chemical addiction and mental illness. In fact, 16 million people of the 26 million in health plans could receive treatment under this bill. When my friend from Rhode Island and I traveled this country holding field hearings on this legislation, we heard literally hundreds and hundreds of stories of human suffering that ripped your heart out. Broken families, tragic deaths, careers, shattered dreams, all because insurance companies would not provide access to treatment for mental illness and addiction for people who were in health plans. We can change that here today. Mr. Speaker, it's time to end the discrimination against people who need treatment for mental illness and addiction. It's time to prohibit health insurers from placing discriminatory barriers on treatment. It's time to join the coalition of insurance companies. Yes, I said insurance companies. More than 10 of them now support this, as well as the major business groups who support Parity. They know it's cost effective, Mr. Speaker. They know Parity saves health care dollars. It's time to make this bipartisan legislation the law of the land. The people of America cannot wait any longer for Congress to act. Mr. Speaker, I reserve the balance of my